All right, good afternoon, everyone, and welcome to our virtual Lunch and Learn Small Business Big App Impact webinar. Today's exclusive webinar is designed to help businesses implement effective, budget-friendly wellness programs that drive employee well-being, productivity, and retention without breaking the bank. We're excited today to have two industry experts who will be leading our discussion who are well-versed in this topic. We have Christina Hansen, who serves as Director of Global Benefits at Verisk Analytics, and Clark Lagemann, CEO of Avidon Health. Throughout this webinar, if you have any questions, feel free to use the chat feature in Teams. This webinar is being recorded and will be shared post-event if you want to rewatch it or if you need to look at any of the information that was shared today. I now want to turn it over to Christina and Clark.
Thank you all. So we thought there could be hundreds of people on, but whether there be hundreds or one, we wanted to make this not your average webinar. So 3 big principles driving today's session. Christina and I will chat through a lot of topics, but one, we're trying to make everything we talk about today practical that you can implement immediately, regardless of the size or budget. Christina will talk about her experiences. I'll share what I see in other organizations. Second thing is, this is your time. Don't be afraid to ask questions, seek advice, gain insights. This is all about you and your needs. And as I mentioned before, your time, not ours. You're pulling your time away from running your companies. We're here to support you. Take advantage of this session. You'll be able to reach out to Christina and I afterwards as well if you have additional questions. But during our conversation, it's a smaller group, but feel free to send in your questions. James will monitor the chat and we can answer them during the call. So let's get started. So why does wellness matter? The average cost of healthcare for small businesses is rising every year. We know this. By 2025, it's expected that healthcare costs will continue to increase by about 5% each year. So there are ways and strategies that we believe are important that you can use to curb those costs. What we've seen, and this is published from Harvard Business Review, there's a bunch of stats we'll put on the screen, is that companies that implement effective programs, so there are wellness programs that are ineffective, and we could probably talk about some of that today, but effective programs can see a decrease of healthcare costs by about 25%. So the thought of today is, one, arm you all with good insights information. You will get a copy of these slides afterwards, which is great, and you'll see some sources on there. We tried our best to citate anything we could. They'll have links in there. You could click on the link to read more information, which is also going to be very helpful for you. So big ticket items, what we're talking about, what we see, increased job satisfaction. We all know why that's more important. Employees who are engaged, they're happy, they're satisfied, they feel more connected to the organization, obviously are going to be more connected and stay longer. So we want to minimize the attrition rate. We want to increase the retention rate. So one of the big factors of why we see wellness programs mattering outside of just the healthcare reduction and healthcare cost reduction. Second is people who are healthy, they stay at work. They're more connected to their families. They're more engaged. They're feeling better mentally, cognitively, and from a health perspective. And the other kind of big item of what we think is important is the mental health crisis. This was really big through COVID. People were kind of sheltering in place. They didn't have the social connections. Most employees still to that day, and you can see these stats in here from HBR, still to that day are expressing at least one symptom of a mental health condition in the past year. So this is a big problem. And as Christina will chime in on here, most of these employees aren't going to come into your office and say, I have this problem, I have mental health issues, come and talk to me. So Christina, when you're looking at your organization, kind of what are you thinking the most important primers are for why these programs matter?
Yeah, so mental health is definitely, I would say, the biggest wellness topic in our organization, as well as others who I do collaborate with. And one of the, there are many reasons for mental health. A lot of, I would say, work stress is definitely one of the larger reasons. Others are just work-life balance with home. There are some personal things that happen in the household, but I know as a leader of our wellness programs here at Verisk, one of the things we try to do is, at least when it is especially work stress related, is to first listen being a listening ear to the employee. We do involve our employee relations team if needed, but one thing we do want to show every employee is our support. So whether it be just being that listening ear, maybe that's all they need. We do have mental health resources that we've procured for our employees to access, from therapists to online tools. And then we also have the local resources available to listen to the employee and help guide them through our available EAP programs as well. So those are some of the items that we at Verisk have for our employees when it comes to mental health, or even just even financial aspects as well. So it's mental health is the biggest, but we also have financial and physical well-being being brought to our attention.
Nice. I mean, and obviously Verisk, a prominent New Jersey company, one of the leaders in the state, they do a lot for their employees, which is why Christina's here to share about her experiences of running these programs and what she's seeing. But also, too, your colleagues are doing this. So HR.com had a survey about the state of employee well-being, and 50% of small to mid-sized organizations are prioritizing employee well-being. So they're talking about it. They want to do something. Today is again about action, about actually truly doing something and making it as effective as possible for your organization, not other organizations, because wellness can have its own flavor within your own individual organization. So moving on from here, the topic is always like, how do I measure success? Obviously, people feel good, they're more engaged. That's a lot of like the soft cost of wellness. It's hard sometimes to really put a dollar amount, because that's what most organizations are trying to do around wellness. So we have two different ways that we see most organizations, as you benchmark yourself against them, of what they're typically doing to measure their own success against the programs that they're deploying. So first we have return on investment. So this is common what you see. This is what you probably are most familiar with, and what you're probably saying, well, this is how I want to manage my own organization and my own investments in our healthcare and our well-being. So I'll pull up some stats on here, and this is kind of some widely cited stats on what organizations can expect if they're measuring their success with their program that they're deploying, and they want to report back to their CEO or report back to their board or report back to themselves of saying, my $1 out returns something for my organization. So it's hard, and we know from a small business perspective, and really any business, when you aren't spending that money directly on trying to drive sales or revenue, sometimes it's hard to justify that cost. But we all know our employees are the most important aspect of our business. And obviously they're the biggest cost of any organization from a payroll perspective, but also from a contributions perspective. So you can look at these stats. These are all going to be helpful for you to think about how you can benchmark the return on your program. One that's coming out more prominently now. So ROI is what I've always heard for years. For the past 10 years, people always talk about ROI. Now I'm seeing much more this shift towards the value on investment. So it's a bit of a different flavor of the same concept, which is we're investing. We want to measure that success, and how do we measure the success on the value instead of the return? So the value, ways you can think about it is, my employees are more engaged. They're coming to sessions. They're interacting on all hands calls. They're raising their hand when you're doing some sort of community event. That's awesome. If you have your employees engaged, they're more connected to your workforce. They're more likely to stay with your organization. So it's one great way to acknowledge that these programs are paying off for you. The second thing is, I mentioned this before, it's so hard. I mean, look, we live in a great state. We have incredible talent, but those employees are seeking great opportunities. We want to reduce that turnover because it's so costly, and certainly running a small business, all of the things that are on your plate currently, for you to stop that, to go and recruit, to go look on LinkedIn to find someone and you don't know who they are, it's difficult, especially if they don't come from a trusted source. So we want to reduce that reduction of turnover. And lastly, as I mentioned, we want to improve the long-term health of our employees. So again, Christina, back over to you. When you're looking at this and you're measuring success, I mean, are you more on the ROI side or more on the value side of what do your leaders within the organization expect from you when you're talking about these programs of making an impact?
So right now, Verisk, I would say, is on the VOI side. ROI does take time to prove, if you will. So one of the reasons why we put the investment in our wellness programs is because we are seeing higher claims costs. Employees would go through a physician, maybe procure a provider, a therapist, a psychologist through their insurer instead of maybe they just needed either somebody to speak to, an online program that could give guidance as to where they could seek help. And all of these programs in combination, of course, one doesn't fit all, is helping to at least show our support for our employees instead of the employee going right to their healthcare provider, using insurance, going through the system, and then we see it in our claims. So we are measuring it currently. We are seeing a lot of high utilization with a lot of the programs that we put in place in early 24. And yeah, where our hope is that we would see the ROI go up. And yeah, more to come on that, but that's where our strategy is in terms of the VOI to ROI path.
Yeah, and Christina nailed it. I mean, when you launch a program to get an ROI, it's just unrealistic. You're investing this, it takes time. So if you're trying to demonstrate the success of the program or prove the success, value on is great. You can easily say how many more people are joining you for your all hands or contributing to some sort of engagement committee or doing something, or how much are your recruiters working, or how often are you filling positions. Like those are easy for you to see within the first 12 months, something that happened. It feels different around here. What is that? What is this thing? It just feels different. That's the value. And then you're going to get to the return on investment next. So great ways for you to think about how you want to measure this. Next piece we wanted to talk about was what is happening in organizations. And more importantly, this is about you. So we started with, this is the agenda. It's about you and your time. So what's happening within your organizations are important to you. So I'm going to ask James if he could put up a quick poll just to assess what are the most common challenges that you're seeing. And we could start to really focus in our attention on those challenges and talk about some of the solutions that can come about to help support you on that journey. So James, if you don't mind throwing out that poll would be great. I'd appreciate that.
Yep, you should have a pop-up on your screen. Go ahead and select as many answers that apply to the question. We'll give you about 30 seconds to tabulate the results.
Okay, so I see the results coming in, which are great. Don't worry, we have answers for all of the challenges, but let's focus in on the ones that are important or most important to you. So let me pull up the screen. So as you saw in the poll, there are a variety of challenges that organizations are facing today to get these programs either off the ground or to maintain and sustain these programs. Christina could probably share 10 more on this list that she's gone through personally on her journey of launching these programs and then sustaining them year over year for her organization. But the ones that kind of bubble up to the top, the most important ones that we see from this poll was our limited physical space for wellness. So let's talk about that one first. And Christina, I'll let you chime in as well on this because you've done a lot of great things with organizations that are spread across multiple offices, multiple states, and even multiple countries. But the idea of you needing to have a physical place for people to come to is the idea that all employees always have to go to the office to work. It's like that idea has significantly morphed pre and post COVID. So many organizations today are relying primarily on digital solutions to meet people where they are, much like we're doing today, make it as effective and approachable and accessible to all employees, regardless of if they're in the physical office on a daily basis, or if they're commuting a long distance, or they want to do something at 6 o'clock at night. So Christina, from your experience on the physical space, like, are you primarily going to digital? Or are you coming up with anything creative that you would address that kind of challenge for the group?
So we do use both. It's a hybrid. We have employees that report into 3 large offices across the US, but we do have a large workforce that is scattered across US, either 100% remote or reporting into a smaller office without any physical gym where they can work out. But what we've done in some of the programs, and this was post pre-COVID and post-COVID, is arrange a walking group. We've also done fitness challenges. And my suggestion really is you have to know your employee culture. Are they into that? Sometimes a digital program is really what they need, and they prefer to work out at home and have yoga or Pilates or some sort of aerobic session that they can do in the privacy of their home. So it really is dependent on your office culture. But at Verisk, we do have a hybrid of people who do come to our workplace. We do have a gym, so we do arrange some programs for people who do report to the office, as well as using the virtual sessions. And then we have also throughout the year, especially not at year end, but during the first quarter, second quarter, we like to have some online cooking classes and things like that to help really just it's not just focused on physical wellness. I mean, the eating part, we have financial classes, and we also have the mental health webinars. So we do a mix throughout the year to hit upon a lot of the wellness concerns that employees may have. So we do webinars as well. So digital programs, webinars, the fitness challenges, organizing a walk. All of those are very good suggestions to really just maximize what you could do for your employees depending on your culture.
Yeah, knowing your culture. So the ones that bubble up most is we don't have physical space. I led with digital. The next big challenge that you guys wrote about was technology barriers. So in complete contradiction to what I said, you don't need to use digital. You literally can print out, which there's tons of great free resources online. You can search for wellness activities. You could print out, which our team does, PDFs. We share them to employees. You can put them on a poster board just to get people to recognize that you are making a purposeful decision to engage your team around these activities. And today it's 70 plus degrees outside in November, which is a big shocker. Get outside, get moving. You can run meetings that are virtual. You can have people just having conversations, a talking meeting where we're walking around. Those are simple, easy steps that can get your team to feel like things are changing. And then you can start to chop away at this. This is not going to be a huge bite of one apple. This is multiple bites of the apple to get to the success that people feel that you're really going to maintain this program and contribute to this program long term. All right, moving on from here. So doing these things, what I normally hear is it's so costly. It doesn't make sense to me. I don't have time. All true, but also they all could be solutioned around. So we want to put this into some tangible, actionable things that we think would be helpful and useful. This is not an exclusive list, but this is just more a starting off list. This is to inspire you, to get you thinking about what can my organization do. But Christina said it at least 5 times before. It's the culture. You know your people better than we do. You know what will work better than we will, but we hope that this is just going to facilitate you to think about options a little differently than you have maybe in the past. So one of which is there's no shortage of opportunities online, so that digital, to engage your people. You have a variety of free resources. Here's 3 that I think are really solid, that there's free versions of these apps that can be used. There's also paid versions of these apps that can be expanded upon. So what I've seen different clients of mine do is they do have free offerings, and sometimes they offer employees something small, modest, like a $10 or $15 to buy up to a program that matters to them. It could be to buying up to a Calm or an advanced version of a Nike or some sort of fitness app. So your employee feels like it's mine, it's my personal information. I feel really good about it, but my employer cares about me, and they are investing in my personal success, which is great. So this is the first place I would say that you can get started, again, if you're a digital first organization. If not, take these same concepts, print out something, put it on your bulletin board, and talk about what you want your team to do. As Christina mentioned, walking challenges, fitness challenges. Print up what you want them to do for the week. Everyone takes home a tear sheet. They come back and say, this is what I did for the week, and they feel really good about it. So it's holding them accountable as well. Next is there's no shortage of things that the state is doing. So I would strongly encourage each of you to take a few minutes to go to the Chamber of Commerce, to some of the local resources you have. In almost all the work that we did in preparation for this webinar, there were access to member exclusive discounts on a variety of vendors across the state. Those are great. So across the state, you have that. What I've seen personally in my experience is relationships that small businesses have with each other. So if you have a gym down the street, or you have a smoothie place down the street from you, If you're in Jersey City, like Christina is, you can walk to the businesses within a block or two of your business and your organization and talk about what you're doing and why it's important for your employees to maybe have access to their resources. And in almost every scenario that I've seen personally, those organizations will provide you with some sort of discount or a fee-based reduction to help make it easier for you to facilitate that, because just like you, they're looking for clients. So if you can facilitate a meaningful conversation that will allow them to recognize how much you're invested in the local community, that your employees will be using these services, those businesses will inevitably lean in and come back and say, here's what we could do for you. So get there, just get started. And also you could type in, if you're in Clifton, New Jersey gyms, and you could just find some that are local to you, which would be very helpful. And I kind of talked about this point, but just to hammer home the value of this is the opportunity for you to do something in your local community is going to be much better than if you just give your employees COM or Nike. The connection that they're going to feel with a local small business is going to be very, very valuable for you, again, to create that culture. You know your culture better than I do, but as Christina mentioned, culture is so important. If your employees care about that, take the afternoon, knock on a couple doors or make a few phone calls and tell your story to these other businesses and get these businesses to buy into your wellness program and to helping your employees. Christina, I know there's 1,000 other things on here. What's like a 1 or 2 highlights of what you think is something else we should consider for like a free or low cost resource for the group?
Yeah, I know from experience, just the local gym, like you mentioned, they're more than happy to offer an employee discount at no cost to a small business because they are looking for members, as well as even childcare facilities. I know that at a prior company we worked with, and same thing, we approached a local daycare, we even approached a franchise. It's called the Learning Experience. We talked to them, and they gave us as well a 10% discount to offer to our employees if they signed up with that company. One thing I did want to add to your point, Clark, that putting this in a PDF, prior to my job here at Verisk, I worked for a smaller company, and just putting together resources on a PDF that's supported by your organization says a lot to your employees. So even just putting, just the apps or just some local businesses where they could go, it speaks volumes that they feel supported by you. So I strongly recommend that, because that's what we did. We did not have a workforce that was at a computer all the time, and so this was helpful.
Right. So let's talk about how to implement some of these strategies. So we have 2 types of businesses. You have those that are based in lovely the Garden State, in-house programs, and we also have things that are designed more for a diverse remote organization. So we'll cover them quickly just because there's a lot of information on the slides, but just to give you some insights. Again, these slides will be shared with you so you can come back and refer to them at a later point. But we want to talk about the in-house programs first. So these are your employees coming on site. There's a variety of different things that you can do, everything from, as Christina started, we've talked about it, the culture, understanding your team and where they are and what their needs are. And based upon that, you start to create the right program for those individual employees and your team. And making it fun and competitive is usually good drivers from an intrinsic motivation standpoint to get people to really believe in a program, to feel good about the program. And from there, we want to insert what we see as the biggest drivers. We started this webinar on nearly 80% of these employees are saying that they have at least one mental health issue during that course of the year. So this is a big opportunity for you to really address the needs that they're currently facing. Knowing your organization, but just broadly speaking, 80% of those employees are going to have one of these issues that should be addressed. And then there's another step that we're going to break out that I think is very important, that we've seen good success across multiple organizations, is the identification of and the help of leveraging wellness champions. So it's great that you all are on the call today. That's awesome. But you can't be the only one championing this for your organization. You have others that are maybe closer to boots on the ground that they can start to share and expose the team to these concepts. So you're doing all this, and of course, measure, repeat, and modify. So this is simple to do, simple steps that you could take right away, very actionable. Christina, I don't know if you want to add anything here, or you want me to just go into some of the remote ones, but feel free to chime in on anything and hear for your experience.
Yeah, just one on the wellness champions. I know we're working on that in Verisk. We've also done that. Well, I've also led something similar at a smaller company. And one thing I just want to share is that if you have staff that would be willing to go above and beyond and become a wellness champion, even showing some recognition for that, even an award or some public recognition within the company, something they could add to their resume. It's definitely an incentive. And I found that more people are interested to become one than we initially assumed. So it's definitely something that I stand by because I know it works. So I just wanted to add that
Yeah, well,
regarding the
let's
champions.
talk about the
Mhm.
wellness champions, because that's just something really tangible and actionable that individuals can do and your organization can do. So big things, I'll pull it all up on the screen, is how do you identify the right person that's going to drink the Kool-Aid just like you, that's going to feel that this is so important for their colleagues that they're going to want to talk about it on a regular basis. So there's some great items, attributes, however you want to categorize this, but ways that you can identify those employees. Again, your organization, probably who's the one's going to say, I want to help Christina do this, and I'm really excited by this. So identify those individuals, and then this isn't a lot of work, but it should be focused work. So we want to create structure around what your ask is for them. So what is your expectation? So there's 5 items on here. Christina, you mentioned your work with Wellness Champions. What are you seeing them do within your organization, and why is it helpful for you running this wellness program?
Well, they're boots on the ground. Largely, they provide that listening ear, which is so important. I could say that when we have an employee experiencing either a mental or maybe it's just I just need to talk to somebody, just having that listening ear and being heard, it I can't tell you how much of a and it's just more than showing that you care. It's really impacting the employee directly. So that's why I really support and champion the wellness champions. We call them ambassadors here at Verisk. That's our term. But we are working on this program, cultivating it, making it a formal program, even with certifications. So because it really just helps with boots on the ground and really that human touch that I think employees really need, especially when they're undergoing some sort of, I wouldn't call it a crisis, but even if they're bothered by something small, just having somebody to talk to is a big deal for them.
Yeah. And boots on the ground could be physically in the office with you, or as we'll talk about this example, how your program can look for a wellness organization. So I'm sorry, for a remote organization. And what's interesting is that there was a Gallup poll that was recently done, is that your people who aren't near you, they feel very disconnected. So Christina's doing a great job for her staff in Jersey City, but also these programs, as she mentioned before, there's people all over the state, the country, and internationally. How do you best engage those employees to make sure that they're feeling that they're as connected to the organization as those that are sitting right next to you on a daily basis? So there's a bunch of different things that you can do that are very tangible. So I'll bring them up on the screen right now, that are all helpful and useful. Because the idea behind this is you don't need to have, for example, on the right-hand side, that meeting, and you want to do the walk-in meeting, with which Christina and I mentioned previously, but you could do a virtual walk-in meeting. So my team, we have people in a variety of different places in New Jersey, but also across the country. We'll say, all right, Teams meeting is happening at 1 o'clock. Everyone put on your earbuds, walk outside, and we're just going to have a chat. It's great. It's helpful. It forces the team to do something they probably wouldn't. And then also it's encouraged by leadership. So again, that culture of your organization, if you're saying it's okay for you not to be on camera, it's okay for you to walk around and we're going to hear horns going, your employees are going to adopt. They're going to feel excited. They're going to move on with that. So that's one really simple, actionable item that you could do to just make things change. And then another one is, if you want to, this is the whole idea of little to no cost items, but there's all the things you can do. So that the home office assessments, what we've done, again, so in another example for our team, we had someone that was an expert in ergonomics, and she would do a virtual session with employees and say, oh, well, let me see how your desk is set, how your chair is set. Oh, here's what we could do. And the employees felt so much like so great about it. It was just so different, so unique, that they were set up for success, because they're always saying like this. You don't ever think of, oh, no one's looking at me. You don't see like that typically when you're in your office, because there's people coming in and out. So it's a very helpful, actionable step. But Christina, over to you again, from what you're doing, both New Jersey, US, and maybe internationally. What's some big things you're doing for your wellness team, for your remote teams?
Yeah, so our biggest focus right now is really mental health. So I'm just going to focus on that subject. We have deployed we contracted with a mental health vendor. So what this provides our employees is accessibility to mental health therapists. I mean, it's different levels. So you could start out with just somebody to talk to, and then depending on the situation, or even if it does escalate to a crisis, you can have access to a psychiatrist if needed. And so that's one of the things that we have changed, where we made mental health support more accessible, especially at the clinical level. However, we do have mental health apps for our employees to access digitally. So and we do use Avidon Health, which we are very happy with, and it just offers that a lot of info sessions. So from physical health to mental health, and then just work-life balance, and it offers a lot of tools that could help our employees from who do work remote and just need that digital support at their fingertips. So we put it on our intranet so it's easy to access. And then we also have our EAP, which is largely being used. So that's an employee assistance program, which also adds an extra layer of support in terms of talking to somebody just with general concerns. So we have that as well. In addition to the mental health, we do have, we organize 5Ks, we organize walking lunches, depending on, like, for example, when there's Breast Cancer Awareness Month, we do a walk during that time. So depending on what we are bringing awareness to, we organize walks, not a virtual walk, but a physical walk. And you don't have to be in the office walking with folks. You could take time out during your lunch hour and report that you supported the walk as well in your own terms. So that's another way we're also trying to reach out to a lot of our remote employees. Yeah, and I think you cover a lot of it here, Clark. I love the ergonomic home office that we haven't done as an initiative, but I think that does say a lot.
2025, coming
Yeah.
2025. So we're excited. You have these great ideas. You're ready to go and do it. It's not if you build it, they will come. It just doesn't work like that. Getting buy-in is a big step in this process. So we want to break it out for you. So from our collective experience, what we see, there's some simple steps that you could do to drive effective engagement. And getting engagements can be critical to any program success. So just a stat to throw out there for you to be thinking about. Employees are 5 times more likely to engage in a wellness program when you, the leader, is messaging frequently and clearly. So it's not just my great thinking. This came from McKinsey. So all the great suits in McKinsey, they're looking at all these best in class organizations, the blue chips and everyone else. And they're saying that if you do this often and you do it clear, you're going to get success. So let's talk about what often and clear looks like, because again, you know your organization better than we do, but just here's an example. So start early, be consistent. We talk about that, but very tactily doing this. 1 month before a program is to launch, you want to start educating your team about this. You could do this through digital. You could do this through something on a board. You could do this through conversations, but start early, get people going, tease it out, get people ready for what's coming. Step 1. Step 2, your culture. How do people talk today? We're on Teams, Slack, it's in the breakout room, it's something else on email. Use whatever is the most natural channel that your team uses, but also don't restrict conversation just to that one singular channel, because that's going to limit potentially the reach. Because an employee that may not be as engaged, the whole idea is getting people engaged. You want to reach them where they are. So use multiple channels to reach those employees. Next is, can't be boring. This webinar is not boring. Wellness isn't boring. So you want to create as engaging as possible content. It could be something, your personal story. It could be a visual that just catches people's attention. There's a lot of really cool, creative things that you can just search for, video on this or cool image for my employees. And there's hundreds of memes you could pull from that are really exciting that will just get someone like, wow, I didn't expect to see this. And I want to take action, because you want them to be educated and informed about what's coming. And that will help them stop what they're used to seeing. It's not a stale email that you've gotten 100 times over. It's something new and unique. And lastly, you know your organization, but ultimately you need to get feedback from your organization. And this is exactly where those wellness champions are a perfect fit. Christina said it before. They're your boots on the ground. They're going to feed you information and what's working, what's not working. They're going to help hold you accountable that this is not hitting the mark or it is hitting the mark. So make sure you're doing that. You could do it more broadly, like polls and getting surveys out, but just the kind of anecdotal stories, you're really going to get a good sense of what matters most to the organization. Christina, on you launching programs, multiple organizations, best practices, what are you seeing from your perspective?
Yeah, as you went through this slide, I agree. I think the examples I've been providing have been more on the mental health. We have a supportive caring approach. However, I want to share that if you are an organization that's looking to bring excitement, maybe through an event or a walk, or just even bringing employees together for, let's say it's a Thanksgiving potluck. I think that a champion doesn't have to be an empathetic or having that kind of like somber persona. You can also have somebody who's very energetic, very charismatic, to really bring your employees together and a different type of energy. So you can have multiple types of champions. And I think that having both sides of the coin, having somebody who's really charismatic in your company and, maybe tapping them on the shoulder to say, hey, can you organize this fun event for us, is a different approach to well-being, but it is well-being.
Yeah. And getting those employees engaged, some of them, they'll raise their hand, but there's other ways to do that. You can use incentives. And this is not designed for you to think this has to come with a hefty price tag. It doesn't need to be that. So here's a couple things you can do to just get your employees to, as Christina mentioned, just feel like, oh, I feel good about doing this. And the reason why it's so important, obviously, is that if they are recognized, they are much more likely to stay engaged and stay productive on whatever you're working on. So some tangible things, a wall of fame if you have a physical office, simple, right by your lunchroom, who did what for the employee of the month, some activity that gets people feeling, wow, I get recognition by doing this. Next is, how many times have you gotten a personalized handwritten thank you note? In the past year, maybe I've gotten one or two. It's usually because of my kids' birthdays. It's not because of something happened at work. So if you take the moment to write something to your team to thank them in a very simple, easy way and give it them that physical sense, it's going to mean a lot to them. Certainly you could do it on email as well, but just getting something in the mail or putting it on their desk is just going to pay huge dividends. Another great one, just shouting them out. Like we do shout outs, like who did something really special. We ask our team to do shout outs as well as they've seen something that someone else did, because you can't be everywhere all the time. So those wellness champions would be great to say, I saw Christina doing this and this is the impact that it had. So it's not always your words, and you're able to kind of really cast a wide net as to who's doing what and help this. All these things we're talking about is to help you as you're shifting the culture into a wellness culture, shift from a traditional incentive model to a more intrinsic motivation model. The intrinsic motivation is what's going to drive and create behavior change. This is a specialty that we have, but creating the behavior change is going to continue to create the buy-in, get people to see real health outcomes, and also help them break bad, unhealthy habits. It's so difficult to do that. If they've been suffering for 10 years and you're looking for ROI on month one of launching a wellness program, you're not going to get it, but you will get that VOI, as Christina said, and you're going to see employees getting more engaged. And how do you get that employee to get that intrinsic motivation and get them to feel like, I want to try harder when it gets difficult next time, and I want to push this, and I'm going to bring my colleagues with me. So these are good 3 steps that we've seen. And Christina, again, always over to you. What are you seeing out there as well?
Yeah, these are great. So I've seen the recognition. We do at Verisk, if you have an awards program. I mean, we have a small financial award for those who really go above and beyond and have really made a positive change or added a lot of value to a certain program. So we do that here at Verisk, but I've written personal thank you notes as well. And the recognition in any way that you do it, whether something small, and I agree with the power of small wins, it really goes a long way with the employee, more further than you think it does. And I love handwritten notes. I think that people really appreciate it. But yeah, so in addition to this, I could say that if you do have budget, a small like gift card or something, we have something called a Way to Go program. That's something that maybe you can implement to help continue incentivizing people to do these things.
Great. And as we're coming towards the end of this session, there's a couple things we wanted to tie this all together. So Christina's been sharing a lot about her experience running these programs, but we want to break this out into one clear package so you can kind of hear from her what she's done and what Verisk is all about and how they're doing things differently. So I'll pass the floor over to you, Christina, to talk the team through this.
Sounds good. So I think that through my examples, caring is one of our core values, and I've shared a lot of how we've done that as a company. So in addition to the discount programs for gyms and wellness centers, the wellness programs that we have in place for our employee is we have financial incentives to encourage health screenings. We work this out with our health insurance carrier. Again, if you have the means to do it, it's definitely something that employees would like to. It's incentive to go to get your annual physical and other. We at one point we did have blood draws where you could see how healthy you are and what you could do to. It brings any health concerns to light, and we do value that people take action to maybe lower their cholesterol or their blood pressure. So all of that is on a voluntary basis, but employees are encouraged to do so. Hybrid and flexible work arrangements. I know we talked about that on this webinar. Online wellness courses, of course, and online mental health therapy for employees and dependents. Again, that was through a mental health program that we contracted with, where it's an extension of our health plan. So we are encouraging our employees, and if they have dependent children or spouses, to use it rather than going to a doctor, rather than going through the red tape of getting a referral somewhere. They can go call this number, go online, speak to somebody right away, and they could get help at the point of call. And so those are a few examples of what we have today. And then I spoke about what we are putting in place in terms of wellness champions. Again, we call them ambassadors. We are working with our vendor on an international accreditation. So we're really formalizing this program so that the wellness champion is not only boots on the ground, but they are well trained. They know how to handle a mental health issue if somebody does come forward with it, and they know how to direct the employee. These wellness champions are not expected to be clinically trained at all. They are not therapists. So they are going to understand that, but they will be trained on how to de-escalate a situation, as well as provide the appropriate support and references to the employee. We have also we did launch a pilot program for mental health trainings for managers. Future state, we are going to launch this worldwide. However, we did do it for one of our big offices in the West Coast, and it was very much well received. It seems like common sense, like where you can provide some directives for your managers, put on a PDF where they can go to for mental health resources for their employees if this is ever needed. However, having a training really offers the opportunity for a manager to ask questions, to really break it down as it applies to their workforce, and their experience. So I do really advocate for a training, a formal training. I think it went a long way with our managers, and it was really well received. We got so many um, requests for more. So yeah, this is that I strongly recommend.
Right. So Christine talked about what she's planning for the future state. I mean, part of it is she's looking at the same journals that I am. She's getting a sense of what her culture is telling her, but she's looking at what's coming. So we want to pull out some trends that are occurring in 2025. So as you're looking to launch this program, you should be preparing for what's coming. And some of these are more prominent. Some of these might be a surprise to you. But the first one that we're seeing, the big trend, have you heard this thing called AI? It's coming around. So yes, everyone is using AI all around. So there's good and bad with this. Some employees are feeling concerned with how their information might be used, but this can easily democratize your ability to run programs for your team and make it highly personalized for the culture that you have. So very simply, you can prompt some of these AI tools, tell the AI about your organization, and solicit feedback and ideas. So it can be your thinking partner. And I would highly encourage you to do that for little to no cost. That's a great resource for you. Next is it continues to be high stress, high difficult for many organizations. So blending that remote and hybrid, people coming back to the office. Some of the larger organizations are forcing their employees back to the office. So people are feeling that strain a bit now. Obviously, the election just occurred too. So people are feeling a little strain. The end of the year is coming up. So all these things are happening. So the dust never is settled. It doesn't seem like everyone's like the post-COVID, it's like, well, kind of the dust settled, but maybe there's still more things occurring there. So being very conscientious about those types of work-life balance is going to be incredibly important. Next is DEI. So meeting employees where they are, their unique needs. Expectation is that organizations, especially best-in-class organizations like Verisk, are doing things like this, where we're making sure that this program can reach all people, regardless of where they are and regardless of what their needs are. So being very conscientious of that, about what we're talking about. And what I've seen even from some of the work that I've done here in New Jersey, if you encourage people to eat healthy, but they live in a food desert, meaning they don't have access to healthy options near their home, what are they going to do? So you have to be very conscientious about that. So not setting your employees up for failure and not talking to them like they should be doing this when they don't have access to that. So if they have those challenges, you want to help them address those challenges, make it very easy for them to get engaged. And lastly, Christina mentioned this many times before we started the meeting with this, the mental health support is incredibly important. Christina's already doing a lot of great work preparing for 2025, already doing these things in 2024, but being very conscientious that your employees, 80% of them have an issue right now. They are not actively walking into your office and saying, help me with this issue. So being conscientious about that others have that same challenge, and being available to create an environment in which they can take advantage of the resources that you make available to them. Christina, anything else you're seeing out there that the team should know about?
This is great. I would like to add, I think that having a variety of support, like there's four right here, just giving the employee that power of choice to have various programs to support where they are, I think is definitely a trend. And people don't want to be told. I think definitely wellness is personal to everybody, and everyone is different. So just having a variety is really a good approach to a complete wellness program.
So now you're thinking, what's next? We dropped all this information on you. You dedicated this time, which is awesome. Congratulations for being here. Let's talk about what you should be doing now. So 3 big things we want to bring out to you. First of which is you could take action today. So start small, think big. So we don't have to take that big bite of the apple, take many small bites of the apple. You're not going to see ROI on day one. So you want to make these small changes, and ultimately you're going to start to shift the culture of the organization. Next big thing is we just gave you 4 items. There's probably 10 more or 40 more that, again, important to your culture and to your organization, to your community, that you need to be thinking about for 2025. So we don't want this program to feel like it was designed pre-COVID. We don't want to feel like it just happened during COVID. We don't want to feel like it happened in 2023. It needs to feel topical and relevant for 2025, for your team's needs, the shifts in the marketplace, and your community. So staying ahead and considering all those items is incredibly important. And lastly, you don't make these decisions in a silo. Christina talked about the ambassadors, the wellness champions. You can involve your colleagues in this. You can involve other organizations. This should be something that you all do in a larger group versus in a silo. And Christine and I want to be resources for you. So one clear other next action item that you could do if you want to continue this conversation is Christine and I are more than happy to continue the discussion. When you get a copy of these slides, both those two boxes you could click on and find us on LinkedIn easily. Send us a message about today's webinar, and we'll be happy to answer any more questions that weren't answered in the chat. So with that, I want to thank you all for the time. We'll open up for a brief Q&A if you have any more questions, but feel free again to reach out to Christina and I privately if you like to via LinkedIn. So with that, James, I'll invite you back on and we can facilitate any last Q&A for the next couple minutes.
Great, thanks. If you have any questions, feel free to drop them in the chat, any comments as well, or feel free to just unmute yourself and ask your question out loud. Otherwise, we also, as Clark mentioned, we'll be sharing these slides post-event. We'll also share the link to the recording so that you can view it at a later time. If not, then we thank you for your time, and you'll be hearing from us post-event via email with the slides as well as contact information for Clark and Christina, as well as the video.
Thank you.
Thank you all. Great to see you.
Thank you.
All right, great. Thanks, everyone. Take care.
Bye.